Now, the goal for Licking Memorial Health Systems has always been to provide its residents with the medical care they need. So when demand grows, they respond. Today, we're delving into the area of orthopedic care with CEO Rob Montagnes, as well as orthopedic surgeons Doctors Kevin O'Lean and Robert Muller. I want to thank all three of you for being with me.
It's good to be here.
Thank you.
Glad to be here.
So, Rob, Licking Memorial Orthopedic Surgery itself just opened last summer in Licking County. So what has been happening since then? How's the practice been received?
Well, they can speak to how the practice has been received from their perspective. I've received a lot of very positive comments. We certainly understand that as the population, especially the baby boomers, are aging, the need for certain specialties, geriatrics, orthopedics, is going to become more and more necessary. And I think to respond to those needs in our community, to be able to recruit some very talented, experienced orthopedic surgeons was important for meeting the needs of our community. So we're thrilled to have the doctors, and I think they've been off to a tremendous start.
All right, Dr. Muller, we'll start with you. So first, kind of explain, orthopedics, what kind of areas are you focusing on? What kind of services do you provide?
Well, orthopedic surgery is primarily bones and joints, and that's just about everywhere in the body, not the skull, and generally not the ribs, okay? But shoulders, elbows, wrists, we do lots of hip fractures, we do knee replacements, hip replacements, shoulder replacements, anything that involves a bone or joint that's out for us outside the spine, we're pretty happy to take care of.
And have you seen, like Rob was mentioning, the demand really growing in Licking County and the need for those services?
Well, I don't know that we have a sense of what it was like before we got here, but I feel like our business has been building very nicely. I feel like the community response has been pretty good. So it's worked out well so far, I think.
All right. And you guys have been in practice together, obviously, right? And things are going to be expanding. So, Dr. O'Lean, talk about kind of the newest innovations that have been happening, because, I mean, that's what medicine's all about, right?
Right. And orthopedics is a very exciting field, and I think this is a great time to be in orthopedics. There's a lot of work being done in orthobiologics right now, which is trying to improve patients' healing by doing things like stem cells or growth factors, and there's a lot of research going into that. That really hasn't made the clinical field yet, but we have a lot of evolving surgical techniques. We have a new type of shoulder replacement, which is called the reverse shoulder replacement, and it's for patients who have horrible comminuted fractures of their shoulders. It's also for patients who have arthritis in their shoulder but no longer have a functioning rotator cuff. And in the past, those folks could get pain relief, but they couldn't get a restoration of their function. And now with the reverse shoulder prosthesis, they can actually use their arm again and reach up above shoulder height. So that's been a wonderful advancement. There's the role of arthroscopy has been extended into hip surgery now. So before, hip pain usually was arthritic pain, and so patients who had an arthritic hip could get a hip replacement, but patients that had a sore hip that wasn't arthritic really didn't have a place to go, and we really didn't have tools to help them. And that's a lot of the athletes who end up with hip injuries that aren't arthritic. And so now we have hip arthroscopy that can help treat disorders of the hip joint that aren't arthritis. And so that's been a big improvement in orthopedic care.
And I imagine when you tell your patients things like that, that there might not have been a solution for them before, but now there is, that they're pretty excited about it.
They're very excited about it. That's, the shoulder arthroscopy came before hip arthroscopy, and it was very interesting to see that evolution where we went from really doing no shoulder surgery up until the early 2000s to now doing it on a daily basis. And the number of patients or backlog that there was, where patients were having pain and dysfunction and nobody could figure out what was wrong with them because we really didn't understand some of the internal workings of the shoulder. So that was very exciting, and now to be able to do that with hip surgery is really rewarding.
All right, and Rob, does Licking Memorial Health System have future plans to expand more, add more doctors maybe? Where's the practice at?
We've got a couple of major projects going on right now. In fact, just up the street, there's a 30,000 square foot medical office building where the good doctors will go and practice, as well as a number of other physicians. Our ophthalmology group, Dr. David Saloni and Law, will be in this new building. And we're very close, just dotting an I or crossing a T for a new facility in our downtown Newark area, probably urgent care and or primary care. Both will be in there, and so we've actually been able to recruit a few primary care. So if after that kiss earlier in the show you develop a frog in your throat, we can hook you up with a primary care physician and take care of your basic medical needs. So a lot of good work going on, both in terms of geographically and with some new providers in the community coming up.
All right, always good to talk with you. Thank you for being with me today, gentlemen.
Thanks for having us.
Thank you.